I posed a question to a friend. Do you think the government would ever intentionally hurt a demographic of people to achieve a political agenda or to obtain more control or to experiment? And without missing a beat, she said, no, of course not. Our government would never do that. They care about us, they want to take care of us. Uh, there's a million things that I can say to prove that the government doesn't give a shit about us as a people, as long as we pay our taxes and keep them in their mansions and the lifestyles that they've grown accustomed to. But we're not going to talk about my opinion today. We are going to talk about facts. I posted this on my Facebook page, and another friend of mine said, it seemed really interesting, and I started to read it, but I don't like to read. So if you make me a video and you read it to me, I'll watch the video, which I laughed at. But then I thought, no, a lot of people are like that. They are interested, they want the information, but reading's not their thing. And if something requires a long read, they won't read, and then they'll miss information. So I thought, what the hell? I'll make a video. I want to start out by saying I'm by no means suggesting the coronavirus is not real or that it's not lethal. I am realistic about it, though. For those of you that don't know, I did have 15 years in the medical industry, working on the front lines, and I am among the at-risk demographic. I have acute asthma and an autoimmune disease, and my son has autism. So I am not so far detached from this pandemic and the concerns that go with it. I, however, choose not to be fearful and not to contribute to the chaos and the contradiction that is coming from the CDC and the FDA and New York. So without further ado, I'm just going to get to my post. So when I posed the question to my friend and she said, no, absolutely not, the government would never intentionally harm us, it concerned me because I have a feeling there's a lot of Americans that sincerely believe that. And I don't know if it's because they don't know their country's history, or because it's an ugly idea, and we don't like ugly things, right? So anyway, so it prompted me to write the post that I wrote on my Facebook page. So in February 2011, there was a meeting of bioethics held in Washington where United States officials acknowledged that there have been dozens and dozens of experiments in the United States and outside of the United States that were funded by the government, experiments and studies that often involved making healthy people sick. So unethical human experimentation in the United States is nothing new. We've often performed experiments without the patient's knowledge or consent. Tests have occurred throughout American history, but particularly in the 20th century. Known experiments where exposure of humans to many chemicals and biological weapons, including infection with deadly or debilitating diseases. Human radiation experiments, injection of toxic and radioactive chemicals, surgical experiments, interrogation and torture experiments, experiments involving mind-altering drugs, and the list just goes on and on. Many of these experiments were performed on children, on the sick, on mentally ill, mentally disabled individuals, often under the guise that it was medical treatment that would cure them or that would help them in some way. In a lot of the experiments, a large portion of the patients were poor, or they were racial minorities, and prisoners. Prisoners were used a lot. But there have been a handful of wide range experiments conducted over entire cities and towns as well. And funding for many of the experiments has been provided by the United States government, especially the United States military, the Central Intelligence Agency, and private corporations that are involved with military activities to some degree. The Human Research programs are usually highly secretive, and in many cases, information about them isn't released until many years after the studies have already been concluded, and it's normally prompted by some sort of investigation. Um, on a confidential level at the time, or provoked by media or witnesses and victims. So let's look into the bioethics of American history. I'm not going to even dive into the shit that happened before the 1900s. A quick Google search will give you all of the grime details of those experiments. So we're going to stay focused on basically our time frame, the 20th century, the 21st century. So in the late 1940s, early 1950s, that's when the United States really started to see a huge growth of pharmaceutical companies and healthcare industries. And that was accompanied by a big boom of prisoner experiments that were funded by our government. And by the 1960s, at least half of the states in the nation allowed prisoners to be used as medical guinea pigs. They were thought to be less than human. In Connecticut, hepatitis was given to mental patients. In Maryland, in 1957, when the Asian flu pandemic was spreading, federal researchers sprayed the virus directly into the nose of inmates in a prison in Jessup, Maryland, to compare their reactions to those inmates that were exposed to the virus who had been given a new vaccine. In New York, critically ill people were injected with live active cancer cells, and they didn't know, and they obviously didn't give consent. The big one that was actually talked about and addressed during Obama's administration was a study done between 1946 and 1948 in Guatemala. Even though it happened in Guatemala, it was federally funded. It was American federal doctors that were injecting prisoners and mental health patients with syphilis. Apparently, the experiment was to test whether penicillin could prevent some sexually transmitted diseases. The conclusion of the experiment came up with no useful information and was buried and hidden for decades. In Alabama, 600 black men were injected with syphilis for an experiment. In 1942, a federally funded study injected experimental flu and vaccine into male patients in a state insane asylum in Michigan, and then exposed them directly to the flu. Researchers studied the transmission of a deadly stomach bug by having male prisoners swallow unfiltered shit at a New York State vocational institution, a reformatory prison. The point of it was to see how well the disease spread orally as compared to spraying the germs and having test subjects breathe it in. Swallowing was a much more effective way to spread the disease. In the 1950s, government researchers tried to infect about 24 prison inmates with gonorrhea using two different methods in an experiment at a federal penitentiary in Atlanta. The bacteria was pumped directly into the urinary tract through the penis. Does not sound like it was comfortable. In 1963, government researchers injected cancer cells into old and debilitated patients at a Jewish chronic disease hospital in Brooklyn, New York, to see if their bodies would reject them. The hospital director is on record saying, again, this is not a conspiracy, this is public record. The hospital director is on record as saying the patients were told, or were not told, they were being injected with cancer cells because there was no need for them to know. From 1963 to 1966, a controversial government-funded medical study was conducted at the Willowbrook State School for Children with mental retardation. The children were intentionally given hepatitis orally and by injection to see if they could then be cured with a pharmaceutical drug. In 1976, which is only 2 years before I was born, at the instruction of the U.S. government, Myron Levine of the University of Maryland School of Medicine in Baltimore began intentionally giving humans cholera. In the 1940s, the United States Army collaborated on challenge experiments that tested malaria drugs on 400 Illinois prisoners. In 1973, humans were being injected with shingles and typhoid at the Maryland House of Correction in Jessup. In 1950, in order to conduct a simulation of a biological warfare attack, the United States Navy sprayed large quantities of bacteria over the city of San Francisco during a project called Operation Sea Spray. Numerous citizens contracted pneumonia-like illnesses, and some died. And those particular tests continued until at least 1969. That is where the paper trail stops. However, it is speculated that the test continued beyond 1969 still. From 1950 to 1969, that is 19 years of experiments on unknowing Americans over certain cities. In 1950, in Pennsylvania, 200 female prisoners were deliberately infected with viral hepatitis. In 1952, prisoners in Ohio were injected with live cancer cells known as HeLa cells. 300 healthy women were also injected with live cancer cells without being told. In 1955, the CIA conducted an open-air biological warfare experiment near Tampa, Florida, and in other areas of Florida with whooping cough bacteria. It was alleged that the experiment tripled the whooping cough infections in Florida to over 1,000 cases and caused whooping cough deaths in the state to increase from 1 to 12 in less than a year. In 1950, the United States conducted a series of field tests using entomological weapons. Try saying that 3 times fast. Operation Big Itch in 1954 was designed to test munitions loaded with fleas. In 1955, over 300,000 mosquitoes were dropped over parts of the United States, particularly Georgia, to determine if the airdrop mosquitoes could survive long enough to bite humans. The mosquito tests were known as Operation Big Buzz. The United States engaged in at least 2 other similar testing programs, Operation Dropkick and Operation Mayday. From 1963 to 1969, as part of a Project Shipboard Hazard and Defense, the United States Army performed tests which involved spraying several United States ships with various biological and chemical warfare agents, while thousands of United States military personnel were aboard the ships. The personnel were not notified of the tests, nor were they given protective clothing of any kind. Chemicals tested on them included the nerve gas VX and sarin, toxic chemicals such as zinc sulfide and sulfur dioxide, and a variety of other biological agents. In 1966, the United States Army released bacteria into the tunnels of the New York City subway system as part of a field experiment called A Study of the Vulnerability of Subway Passengers in New York City to Covert Attack with Biological Agents. The Chicago subway system was also subject to a similar experiment by the Army. In 1986, the United States House Committee of Energy and Commerce released a report entitled American Nuclear Guinea Pigs: 3 Decades of Radiation Experiments on U.S. Citizens. Human radiation experiments included a wide array of studies, including things like feeding radioactive food to mentally disabled children, inserting radium rods into the noses of school children, deliberately releasing radioactive chemicals over United States and Canadian cities, measuring the health effects of radioactive fallout from nuclear bomb tests, injecting pregnant women and their babies with radioactive chemicals, and I'm not even going to read what they did to the testicles of prison inmates. It was not good. Between 1960 and 1971, the Department of Defense funded non-consensual whole-body radiation experiments on mostly the poor and black cancer patients who were not told what was being done to them. Patients were told they were receiving a treatment that might cure their cancer, but the Pentagon was trying to determine the effects of high levels of radiation on the human body. From 1950 through 1953, the United States Army conducted Operation Long Area Coverage, spraying chemicals over 6 cities in the United States and Canada in order to test dispersal patterns of chemical weapons. Rick Wise, I'm sure you've heard of him, a spokesman for the White House Office of Science and Technology Policy, was quoted as saying, when President Obama was briefed on the details of the Guatemalan episode, one of his first questions was whether this sort of thing could still happen today. My response to that is, I don't see why not. Matthew Mamoli, a doctor, in 2011, said that intentionally infecting people is an odd pursuit for a doctor. He proposed new human challenge studies with influenza in 2011, which ultimately aimed to test novel viruses, treatments, and vaccines. He's quoted as saying, "We're purposefully making people sick. It's a different idea than what you originally go to medical school for, but over the course of the next few years, I think we're going to get information that's going to be tremendously helpful." He says the trials go through extensive ethical reviews and the risks of transmission is near zero if people have good hygiene. I think we have determined people as a whole generally do not have good hygiene. A group at the University of Oxford, led by pediatrician Andrew Pollard, has conducted a challenge study of experimental vaccines against typhoid and paratyphoid. He worries that even though researchers today address risks more carefully than ever before, someone could push it too far. There is always one in every group. In the last 25 years, 2 significant international government-backed studies caused outrage. One of them was in Uganda, a United States-funded program, and the doctors in Uganda failed to give the AIDS drug AZT to all of the HIV-infected pregnant women in the study in Uganda, even though it would have protected their newborns. U.S. health officials argued the study would answer questions about AZT's use in the developing world. However, there were still many newborns that could have been saved. The other instance was the United States gave an antibiotic named Trovin to children with meningitis in Nigeria, even though there were doubts about its effectiveness for that particular disease. Critics blame the experiment for the deaths of 11 children and the disabling of countless others. That didn't happen in the 1940s or the 1950s or the 1960s or the 1970s. This is during our lifetime. In 2010, the United States Department of Health and Human Services Inspector General reported that between 40 and 65% of clinical studies of federally regulated medical products were experimented and done in other countries since 2008, and that proportion probably has grown. Do you need me to read that to you again? 40 to 65% of clinical studies of federally regulated medical products and experiments are done in other countries since 2008, and that proportion has probably grown. The report also noted that United States regulators inspect fewer than 1% of foreign clinical trial sites. In other words, they're not regulated when they don't happen here. It seems there have been plenty of experiments with diseases such as influenza completed by the American government and performed here or performed in other countries. I don't think it is a leap to at least consider, I'm not saying take the idea and run with it, but to consider, to keep it in the back of your mind that perhaps, maybe, it is possible that COVID-19 was an influenza type of experiment that was occurring in China. And I will just leave it there.